Now to the latest on the coronavirus pandemic. The latest numbers from the State Department of Public Health showing more than 37,000 cases in Georgia and more than 1,600 people have died. The death toll in the U.S. now nearing 90,000 as every state except for one is now at least partially reopened. And now one of the president's top economic advisors is blaming the CDC for its initial response to COVID-19. Christy Diaz joining us live from her home in Fulton County. And Christy, not everyone agrees with this particular official, including some in the White House.
This is very much a political back and forth and kind of turning into a blame game. So let's start with that top White House advisor, who he is and exactly what he said. Peter Navarro is the White House trade advisor and coordinator of the Defense Production Act. He criticized the CDC for how they handled the pandemic early on. Now, the agency did have technical difficulties as they were coming up with a test for the virus, which led to some faulty results. So here is what Navarro said. Take a listen.
Really let the country down with the testing, because not only did they keep the testing within the bureaucracy, they had a bad test, and that did set us back.
The CDC ultimately released new test kits and broadened its testing criteria. But like Sheba said, not everyone agrees with Navarro. Other officials are standing with the CDC, knowing that this all new territory and figuring out how to control and test for a brand new virus we've never seen before is likely going to have some bumps in the road. Now, at this point, only 3% of the population has been tested, even though almost every state has partially reopened. Sheba.
A second, much larger shipment of the antiviral drug remdesivir going out to Georgia hospitals this week. The drug decreasing the amount of coronavirus in the body, helping patients recover much faster. The State Department of Public Health distributing its first allotment of remdesivir last week. It's enough to treat about 110 patients. The drug will first go to hospitals with 10 or more COVID-19 patients on ventilators.